I'm Hillary Blackburn. I'm the Director of Pharmaceutical Services at Dispensary of Hope, creator and host of the Talk to Your Pharmacist podcast, and founder and CEO of the Natural Products Resource Center. So I'm a clinically trained pharmacist who's been practicing for over 7 years in a variety of healthcare settings. I grew up in the Mississippi Delta and attended the University of Mississippi as an early entry pharmacy student. So many schools across the country have these early entry programs, and it's a way to enter pharmacy school as a high school senior, and as long as you maintain your grades and keep up with all of the other requirements, it's a great way to go ahead and get started in pharmacy school, and that worked really well for me. So while I was in pharmacy school at Ole Miss, or the University of Mississippi, I really chose a variety of rotations to get a broad experience, and even served as an intern at HRSA's, or the Health Resources and Services Administration's Office of Pharmacy Affairs in Washington, D.C. During one of those summers in DC, I had the opportunity to attend APHA's Summer Leadership Institute. That's a great opportunity for students to connect with others from across the country who are also emerging pharmacy leaders. So some of you may know that the Office of Pharmacy Affairs manages the 340B program, which is a government-run program to help low-income uninsured patients. And so that was just a different experience for me to explore more of a public health standpoint of how to impact broader patient care. So this HRSA internship really allowed me to learn the insight and the importance of caring for the underserved or safety net population. So after graduation from pharmacy school, I completed a PGY1 pharmacy practice residency at the University of Mississippi Medical Center and really loved clinical care. I loved being in the ER and in the ICU, and even rounding with the internal medicine team. Even being in the ambulatory setting was a great experience, and I really loved all of the preceptors there. But when I moved to Nashville, my path changed a bit as there weren't as many hospital jobs here, and I had the chance to work with a family friend who owned an independent pharmacy here. After doing that for a while, I had an experience with a health plan, so learned all about prior authorizations and formularies, and then worked for a mail order specialty pharmacy. Learned about acquiring licenses. So I'm actually licensed in 11 states because many states require their pharmacists to be licensed in that state to be able to mail prescriptions in. So a lot of NPJEs there. So now I'm at Dispensary of Hope, and I'm able to combine all of these skills and experiences in the role where I am today. So what is my role at Dispensary of Hope? Well, it is non-traditional in a sense, in that Dispensary of Hope is a charitable medication distributor. So what that means is we work with pharmaceutical companies who donate medication to us, and then we distribute it to pharmacies and clinics across the country for their low-income uninsured patients. So this was a role that did not exist initially before I started in this position, but it shows the importance of volunteering. So I actually volunteered for Dispensary of Hope to develop their formulary, and that just goes to show you that sometimes volunteering can lead to some great and unique opportunities. So I've been with Dispensary of Hope since November of 2015. And as the Director of Pharmaceutical Services, I'm responsible for providing clinical pharmacist expertise to support the organization, as well as its network of pharmacies and clinics across the country. I consult with pharmacy leaders across the country, sharing expertise on affordable medication access for low-income patients. And my work with health systems includes strategy development for identifying and implementing programs to address gaps in pharmaceutical care through inclusion of the Dispensary of Hope program. In addition, I lead our research and formulary development and create tools for successful program implementation by pharmacies and charitable clinics across our network. I've helped to maintain and develop relationships and strategic partnerships with several external organizations, including the Advisory Board Company, Belmont and Lipscomb Schools of Pharmacy, and UT School of Pharmacy, and also our newest partner, which is with the University of Mississippi School of Population Health. So, how did I start a podcast? Well, the idea for the podcast began in the spring of 2017 after I'd been listening to a lot of entrepreneur podcasts with my husband, such as How I Built This, Entrepreneur on Fire, and TED Talks, and wanted to create a podcast dedicated to showcasing pharmacy leaders who are doing innovative things in healthcare. So Talk to Your Pharmacist was created for pharmacists, student pharmacists, and for others out there who want to learn more from industry leaders about perspectives on current industry trends and their leadership stories. So I knew that I wanted to go beyond a podcast, which is why it's under the umbrella of the Pharmacy Advisory Group. And under PAG, or Pharmacy Advisory Group, I can offer consulting, speaking, and advising to companies that are interested in the pharmacy space. Having a podcast has given me the ability to put myself out there, expand and build my brand as a knowledgeable and trusted voice in the pharmacy industry, and as a way to connect with other pharmacy leaders. So the podcast, if you're interested in learning more, is available on iTunes and SoundCloud. And our website, www.pharmacyadvisory.com, has all of the episode show notes and a sign-up list to get our newsletters. We are even launching Talk to Your Pharmacist t-shirts and mugs. So our Facebook page is Pharmacy Advisory Group, and our Instagram account is Talk to Your Pharmacist, so that you can stay up to date with what's going on with us. So what are some things that would be helpful to learn in pharmacy school, or maybe that you can pick up along the way to help you succeed in your career? Well, in my case, I would say that would be more of the business and management knowledge. So whether you're a pharmacist in really any role, having those management and leadership skills will help you not only manage employees such as pharmacy technicians, or maybe you're working with other pharmacists, nurses, other people throughout the healthcare industry, and just being able to work collaboratively and to manage others is an important skill. Also knowing a little bit more about business and communication. Communication is so key. Not only are we talking with patients on a daily basis, but you might be talking and communicating with other healthcare leaders. So being able to have a clear message is so important. I'm also learning a lot more about how pharmacy fits in with the broader healthcare experience and healthcare team in my role. And so I think knowing that and having that perspective is so important. So what kind of skills would be helpful, or that have helped me to succeed in my career? Well, one, I would say the ability to work collaboratively. So I've always been a part of teams, whether that's been soccer teams or other athletic teams growing up, and interacting well with others. So in my role at Dispensary of Hope, I support all of our departments here: supply chain, distribution center, account management, and expansion teams. Two, taking opportunities. That's something that you'll hear a lot from other guests who are on the Talk to Your Pharmacist podcast. So this was a completely new position at the Dispensary of Hope. And so taking that leap of faith and being able to work with a great team here, I've really been able to build and create my role here. And taking opportunities along the way. There had never been a student who had interned from Ole Miss at the Office of Pharmacy Affairs, but after I interned on the Hill for a Mississippi senator, I wanted to go back for pharmacy. So I think just always thinking and looking at, how do you expand and develop your skill set, because that helps to build along the way. And third, creating win-win opportunities. So that's taken from 7 Habits of Highly Effective People, which is an excellent book by Stephen Covey and is worth a reread if you haven't read it in a while, so that those are becoming some of your habits. But the ability to make connections with others to create mutual and win-win partnerships is so important, which is how you have to look at it when you're looking at strategic partnerships and developing those. So let's talk about the future of pharmacy, which is really exciting because that space is just continuing to grow. So maybe you're in pharmacy school and you're thinking that retail pharmacy or hospital pharmacy isn't for you. Well, there are a lot of other opportunities and alternative or maybe non-traditional career paths. So it just depends on what you're passionate about. And I'm certainly passionate about our profession and the opportunities for pharmacists. I believe that it's even been coined the versatility of a PharmD. So as you can see from the wide variety of guests that I've had on the podcast, a pharmacy degree truly prepares you for just about anything. You learn great critical thinking skills, the ability to research, taking complex information and simplifying that. So some of the biggest areas of pharmacy that I see in the future would include pharmacogenomics, pharmacists being more integrated in ambulatory care settings because that will help with the shortage in primary care, and even in new therapies such as medical cannabis, which is why I'm working on a training program for pharmacists over at the Natural Products Resource Center, which is available at www.npr.center. Thank you again for inviting me to be a guest on this TED Talk series, Howard University School of Pharmacy. And if you want to connect with me, you can find me over at Instagram, Talk to Your Pharmacist, on the Facebook page, which is the Pharmacy Advisory Group, or email me, Hillary@pharmacyadvisory.com. Thanks again.